Hi, I'm Kaitlin Klimosko, and I'm a registered clinical counselor. I struggled with an eating disorder in my kind of late teens and most of my 20s, to be honest. And I went and saw a counselor for that when I was 17. And that's kind of what opened my eyes to this world and knowing that counseling was a thing that existed and how beneficial it could be. I've seen probably four, five, six counselors throughout my life, and each one have been very integral to my journey and getting to where I am today. My healing journey has really influenced what I bring to therapy and how I approach my work as a therapist, in that it kind of sparked this curiosity for all things mental health. I think when you're struggling with something, you really want to understand for yourself why. That's something that I bring in is I bring kind of life experience and knowing what it's like to struggle with some of these things. And I bring also just this sense of hope and belief in my clients that they can absolutely find the tools that they need to get to the other side. My therapeutic approach focuses initially on building a relationship with you and getting to know why you come, what you need. You know yourself way better than I do. You know what feels good or doesn't feel good in your system. Maybe you don't know it right off the bat, but you really do have all the answers that you need. And my approach is more to help you bring awareness to what you probably already know on some level, subconscious or conscious. And I really like the healing process to be collaborative with you. When I think about what I want clients to walk away with, like a sense of agency, feeling like they are driving the bus. And then I also want them to walk away feeling like they just spent an hour with someone who genuinely really cared and wants to see them do well. It takes a lot of belief on both the therapist side and the client side to see great outcomes. And yeah, I hope that they sense that in me, that I believe in the possibilities for them and for feeling better on the other side. When it comes to progress, I do my best to make sure that I'm pointing out changes that I'm seeing, because sometimes I see with clients that I'm seeing growth, but maybe they haven't recognized certain pieces that they've actually made big change in. The therapeutic process isn't linear. We're connecting about the progress that you want to see and making sure that you're getting where you want to go. I'm someone that really likes to go back to goals. Sometimes those goals change from the first session, and that's totally okay. But I like to keep going back to just making sure that we're staying on track in terms of what you want to see in terms of outcomes. I've had lots of clients that will come for a bit and then they'll pause and they'll come back. And it's really just what works for you. I see my job as giving you the tools that you need to not need to see me forever.